Well, they had headaches, body aches, sore throats, upper respiratory issues, and fevers. But these COVID-19 cases were in a select group. They take care of moms and babies. Anchor Kristen Hartman joins us with this story. Kristen.
Tanya, I'm told the 9 nurses from St. Elizabeth Labor and Delivery are recovering well after immediate self-quarantine. Their cases emerged the last week of March. The 2 staffers I spoke with over Zoom wore masks because they were in the same room. It all offers a glimpse into how practices and times have changed since COVID-19.
You're so sweet.
The St. Elizabeth Healthcare family birthplace is often joyful. This is file video from one of those happy times in the labor and delivery department. But since the end of March, employees here have had to deal with some sobering news: coronavirus cases within their ranks.
Did that hurt your heart just a little bit?
It felt like a punch in the gut, to be honest with you, because first, I find that it's my responsibility to make sure that we have a safe place for our associates. The last thing I want is for our associates to become ill.
Or to potentially expose the patients they serve. Because of the diagnoses, we're told team members called about 10 families who came in contact with the nurses.
Were any of the mamas worried about their babies being affected?
I think yes. I think that's a very, yes, I would be worried too, and they asked great questions. What do I need to look for? Who do I call? Every single mother was very receptive to our call.
Perspective now. The St. E's staffers I spoke with say any nurse in a delivery situation where moms are pushing would wear an N95 mask with a surgical mask over it. And St. Elizabeth has had a policy requiring basic masks in all common spaces and for patient interactions for 16 days already.
I have every confidence that we are doing everything that we absolutely can to, tackle this nasty virus.
Including deep cleaning with multiple mechanisms.
2 and 3 times a shift, Kristen, not just a day, a shift.
Which I reported on weeks ago. But we've established COVID-19 is highly contagious. Here's a sampling of headlines from around the globe about healthcare workers being infected. This one yesterday talks about thousands in the Detroit metro area.
Why are you guys talking to us at this juncture about this?
Number one, it's going to happen, Kristen. We know that. Our associates are going to be ill just like the community is ill. Our associates are part of the community.
And you know what? They wanted to use their story to remind people, stay home. You cannot pass the virus if you don't come in contact with anyone, including healthcare workers. Now, I emailed Mercy, TriHealth, UC Health, and the Christ Hospital to ask how many internal cases they have. Only Christ confirmed having employees who tested positive for COVID-19. Like the 9 L&D nurses at St. E's, those personnel self-quarantined immediately, and the hospital got in touch with their contacts. One last thing to keep in mind, Tanya. St. E's employs 9,000 people system-wide.
Wow, it's so many people, and it's just bound to happen. Kristen, thank you so much.